We are here today because the promotion of breast milk substitutes using unethical marketing practices continues throughout the world. But many countries are fighting back by implementing, monitoring, and enforcing the International Code of Breast Milk Substitutes. So during our time today, we will highlight the findings of the 2024 Code Status Report, and together we will learn which countries hold formula manufacturers to account for the predatory marketing, and we will still have to hear a lot about countries who have a long way to go. Today, we will also learn about key recommendations to protect mothers and infants from these marketing practices by infant formula companies. And finally, we will hear from countries about what works and the hurdles they still face in their efforts to protect mothers and infants from these misleading marketing practices. But before we hear from our first speaker, here are a few housekeeping items for our webinar today. Simultaneous translations and interpretations are available in Arabic, Chinese, French, English, and Spanish. We will not be able to provide a Russian interpretation today due to a last-minute emergency. Please click the translation button at the bottom of the Zoom window to choose your preferred language. Please share your questions for the speakers in the Q&A box, and speakers will address questions in the Q&A box throughout the webinar. And we will aim to answer as many questions as we can. If you need immediate technical support, please begin your question with the word support using all the uppercase letters so we can see that. Just to let you know that certificates of attendance will not be issued for today's presentation. A link to the recording of today's session will be emailed to all registered participants. And now, let's start today's webinar with a welcome from our Director of Nutrition and Child Development, Dr. Victor Aguirre. He will share with us why this topic is so essential to UNICEF's work. Victor, over to you, please.
Thank you, Fatmata. Dear colleagues and dear friends, greetings from UNICEF headquarters in New York, and welcome. Welcome to this global webinar on the 2024 Code Status Report, which we are co-hosting with WHO and, of course, the Global Breastfeeding Collective. As we know, the 2024 report documents progress in national implementation of the Code of Marketing of Breast Milk Substitutes, which, as we know, is key to protect, promote, and support breastfeeding. But before we talk about the future, I would like to take a minute to celebrate progress on breastfeeding. We know that when governments choose to invest in protecting, promoting, and supporting breastfeeding, positive change for breastfeeding is possible. Most recent data from WHO and UNICEF show that the percentage of infants under 6 months of age who are exclusively breastfed has increased over 10 percentage points globally in the last 10 years. That is from 37% to 48% globally. This major achievement shows that positive change for breastfeeding at scale not only is possible, but actually is happening across countries and across regions. And we are poised to meet the 50% target by 2025. So let's take a minute to celebrate what we have achieved together. We know that breastfeeding is one of the most cost-effective interventions for the survival, growth, and development of infants and young children. Yet, as Fatmata was reminding us, aggressive marketing practices by breast milk substitutes companies and pervasive interference of formula industry in policymaking are, in many places, undermining national efforts to implement the Code of Marketing of Breast Milk Substitutes. 40 plus years after the adoption of the Code of Marketing of Breast Milk Substitutes, marketing of infant formula still represents a major threat to the survival, the growth, and the development of children, but also to the right of children and families to information, protection, and a sustainable planet. So the effective implementation of the code is truly a game changer. Evidence across the world shows that rates of exclusive breastfeeding and continued breastfeeding are significantly higher in countries that have enacted national legislation aligned with the code. So the report we are going to be hearing about today highlights progress. More and more countries are strengthening their national legal frameworks to protect breastfeeding despite strong industry resistance. We will hear from the authors updates about the status of implementation of the code in countries, and we will hear from the panelists about how all of us can contribute to our collective obligation to the code. So breastfeeding saves lives. Let's be very clear about that, and let's say it loud and clear. Breastfeeding saves lives, but it also saves money, and it also saves the planet. Breastfeeding is best feeding, and that's saved to everyone. This is why UNICEF and WHO are calling on governments, donors, civil society across countries and regions to step up policies, programs, and services to protect, promote, and support breastfeeding. And this includes passing and enforcing legislation in alignment with the Code of Marketing of Breast Milk Substitutes to protect babies and families from the aggressive tactics used by formula companies. So to all our partners today, we say that UNICEF and WHO stand ready to work with all of you, with all governments, to protect millions of children and to give them the best start in life everywhere. So on that note, I want to hand it back to Fatmata, and let's start with the webinar. Fatmata, back to you.
Thank you so much, Victor, for those inspiring remarks. We are all here today because we care deeply about creating an environment where families can reach their infant feeding goals. And as we know, the code and its related resolutions really play an essential role in making that possible. So let's take a moment to hear directly from mothers about how predatory marketing affects them during this important period in their life. Janet, let's have the video, please.
Hello, my name is Mia. I live in Jakarta, Indonesia.
Hello, I am Anna. I am living in Luxembourg.
بالعافية. أنا من سوريا واسمي فوزة.
Hola, mi nombre es Liz, soy de Ecuador.
I'm Babran, I am Ugandan.
Hi, my name is Lucine. We live in Lebanon.
My first name is Carla. I live in Europe, in Italy.
Hello, my name is Lauren. I live in the United States.
The pediatrician said to me, we will be forced to give her formula, this formula, and he showed me a free package. My milk ran out in less than 2 months.
I get promotions, goodie bags with formula, a can of formula from the hospital too, when I get discharged from the hospital. And I got also phone calls from the sales promotions, keep asking how I feed my baby, how's my baby growing or not.
My perception of breastfeeding changed based on marketing efforts. I just felt that breastfeeding would be such a challenge and a burden and just altogether impossible during a time that's already a real challenge. I received lots of samples for formula saying that it was a healthy substitute for breast milk and that it would be much easier on me. So I thought, what a win-win.
خلفت من 7 شهور هنا بالمستشفى بلبنان طبعا، وطلعت بعد لما طلعت من المستشفى أعطوني علبة حليب هدية للصبي، وبلش الصبي ما يرضع شوي شوي يعني صرت أنطيه حليب حتى يسكت ما عاد يبكي وهيك شيء، وما عاد بده يرضع من صدري، صار يتكل على الحليب، وما فيني أنا على الحليب بأمن له إياه لأنه الحليب صعب تأمينه وغالي شوي ووضع المعيشة صعب.
Cuando mi hijo nació, le proporcionaron allí un biberón de leche de fórmula. Yo solicité al personal de salud que mi bebé fuera puesto al pecho, lo cual las enfermeras, aduciendo que yo debía descansar, se llevaron a mi bebé y le proporcionaron otro biberón más de leche de fórmula. Esa tarde salí con el alta médica, un biberón y una lata de leche de fórmula en el bolso.
My experience at the hospital was not so good because at some point I was asked to introduce formula. So they kept coming in and asking me and telling me that I need to introduce and it's their responsibility. So I was confused and I was actually scared. However, I do wish that the marketing efforts would be more unbiased and factual so that families can make well-informed decisions on how to feed their babies.
I think we need to find good comprehensive regulations to protect this. There are gaps where the industry still can reach mothers for their aggressive promotions.
During antenatal care of this baby I'm holding, because of protection from marketing of formula, there was no exposure to marketing. But instead, there was counseling on breastfeeding. The health facility did not have samples of formula. Immediately after birth, a male counselor from the health facility supported me to initiate breastfeeding and encouraged me to continuously and exclusively breastfeed my baby. My baby boy is now 11 months old and continues to breastfeed.
بفضل أخصائية الرضاعة من جمعية IOCC بلشنا نعطي الولد على صدري لحتى صار عمره شهر وقطع الشهر وشلنا الحليب بفضله وتتردد علينا كثير لحتى بلشنا نعطيه صدري، بلش ياخذ صدري لحتى بلش يكبر شوي. وتعرف الوضع انه مش منيح، ما فينا قدرة على الحليب وما فينا قدرة نأمن للولد حليب.
During my prenatal visits, during birth and my postnatal stay, I was not exposed to any marketing material of breast milk substitutes. I feel a great support in my breastfeeding journey.
Immunity fulfilling
is respect.
Heartwarming.
وعم رضاعة منيحة للولد وللأم، الاثنين منيحة بنفس الوقت. والجيب أهم شيء.
We also need to protect it and support it and promote it with all our hearts, so every mother can breastfeed their children. Thank you.
Wonderful. I would just like to take a moment to thank the mothers who took part and who took their time to share their voices with us. We are posting the link to the video in the chat should you want to share it with others to inspire action on the code. So in a moment, we will hear about the key findings from the report. But first, we would like to start out by finding out a bit more about what you already know about the code in your country in terms of legislation. We will use Mentimeter. So what you have to do is visit the link in the chat using any browser on your computer, tablet, or your phone. But if you cannot access the chat, you can visit menti.com. That's spelled out as MENTIDOTCOM. Please enter the code for today's call. The code is 21152808. That's 21152808. You may also use the QR code on the screen. So let's go. Our first question is, in the last 2 years, has your country made progress towards a code legislation? Let's see what the responses are. Interesting. Looks like a lot of countries made progress towards code legislation in the last 2 years. Thank you for all your support and efforts. So, to facilitate participation of everyone on the call today, you will find translation of the questions on your screen. as well. So let's go to the second question. In the last 2 years, has your country made progress towards code enforcement? Sorry. No, nothing about code monitoring. Sorry. So in the last 2 years, this is really a gap. Very many countries have not made progress in terms of monitoring the code. So this is really an eye-opener that we need to do a lot. It's not just about having a code in place. Monitoring is equally as important as having a code in place. Next, please. The next question is, in the last 2 years, has your country made progress towards code enforcement? Many people are answering no to this. So it really shows that a lot needs to be done in terms of code enforcement. It's not just about having the code in place, but monitoring and enforcement needs to be done by many countries. So this is great to know where we all are on the code. So your responses are really helping us to see why all the findings of this report are so essential. I will now like to introduce Dr. Lawrence Grummer-Shawn. He serves as the unit head of nutrition and food safety actions in health systems at the World Health Organization. He will give us an overview of the key findings of the report, which was authored by UNICEF, WHO, and IPFAN. Larry, over to you, please.
Thank you so much, Fatmata. And good morning to those of you who are getting up very early for this. Good afternoon for some of you, and good evening for those of you who are staying up late for this webinar. Really appreciate your attendance today. We are going to be talking about the status of the national implementation of the International Code of Marketing of Breast Milk Substitutes. This is an annual or a biennial report that we present to the World Health Assembly every 2 years. It is a joint report of the World Health Organization, UNICEF, and IPFAN, the International Baby Food Action Network. We've been doing this joint report every 2 years since 2016 across these 3 agencies, and it is truly a collective effort of all of us to shape the messages, but also to pull together all of the evidence and analyze what is going on internationally. Next slide, please. Over the last few years, we have done quite a bit of research, and I'm sure many of you have been on the webinars and seen the media about some of the research that's been done that has really tried to understand what is the impact of the marketing of breast milk substitutes. How does it actually affect breastfeeding rates? Oftentimes we hear industry say that we're just trying to work for market share. We're just trying to make sure that we're taking, we don't want other companies to grow larger than our company. But they ignore the fact that they are in fact hurting breastfeeding. We know from the research that we've done that marketing of breast milk substitutes actually creates an artificial demand for formula. Yes, we know that there are some women in the world, some babies that need to use formula given their circumstances or the health of their baby. However, there is an artificial demand being created that many people feel the need when they actually should be able to breastfeed. There is, we know that breastfeeding, or that the marketing of breast milk substitutes undermines confidence in breastfeeding, makes us ask questions that, is it really going to work for me? Is it possible in my circumstances? And undermines our ability to support breastfeeding. We know that it exploits maternal concerns over things that are normal in babies. Is my baby growing well? Maybe the baby's growing perfectly fine, but mothers are very worried about that, and industry takes advantage of that to push their products. But what is often not talked about is how it actually impacts on many others besides families themselves directly. It undercuts various systems of how we come to support breastfeeding. So when employers hear that formula is just as good as breastfeeding, then they feel that it's not important for them to provide protections for breastfeeding or to extend maternity leave longer. Healthcare providers are educated on how they can support formula feeding, but they're not educated on how they can support breastfeeding, and it shapes their attitudes, the education that they give to their families, the messages that they share. It changes the funding in our healthcare systems of how we actually support breastfeeding because that marketing shapes the environment. Next slide, please. Over the last 2 years, we have had concerted efforts to try to support code implementation at the national level. Last year, we had, for the first time, a global congress on implementation of the code, brought together nearly 400 people from around the world, 130 countries, to really look at how do we do a better job in strengthening our legislation, our monitoring, our enforcement, to really make sure that the code of marketing of breast milk substitutes becomes a reality for all women around the world. We've also sponsored workshops in multiple regions around the world to really answer those technical questions. How do we actually get to effective legislation and work through the process to get there? We've published a Lancet series on breastfeeding, as we do every few years, and this time really focused very much on the impacts of marketing and also the upstream determinants that actually shape it, that is much easier for marketing to have the power to influence families in ways that was never possible years ago. We've put out a new training course that can train people about the content of the code and how it is used, as well as documents to give an overview to avoid the technical language that sometimes confuses people about the code, to make it easier to understand. We've given guidance documents on how should the code be used to address digital marketing. That is a new way of marketing that is in principle covered by the code, but oftentimes has nuances and complexities that are hard to deal with. We've put out model laws that can help countries shape their own legislation. We've put out clarification documents on the implications of the provisions within the code about sponsorship of healthcare professional associations and of meetings. And we put out guides on industry interference and how we can address the kind of interference that is happening through that legislative process. Next slide, please. So let's get into the report itself. This report is based on an analysis of the national laws, regulations, and decrees that exist in all countries around the world. We cover every country and the information that we can get about what is going on in each country. Oftentimes we hear complaints from people that say, well, this isn't exactly what my country has about the code. And we say every time, if you think that your code, your legislation is not appropriately represented in this code, please let us know. Send in the documents that might be listed. In the appendix of the document itself, which is now available online, you will find listed the exact documents that we analyzed for this report. And if there are things that are relevant to the code that we've missed, please let us know so that we can always report on this. We say this every few years and we still get complaints. So we want to make sure that we are giving that opportunity to correct us. We do an analysis of exactly what is written in the code legislation. There might be times that we've made a misinterpretation of something, so we need to have conversations about why some people think it should be interpreted differently than we have. But we try to make sure that that analysis is consistent across all countries. What we do with each law is we then evaluate it against a checklist of code provisions. All of the subsequent resolutions are included in this analysis as well. And we go through each of those to see how the legislation or the decrees and laws in the country actually stack up against what has been called for by the World Health Assembly over the last 42 years. Next slide, please. So when we take those analyses against the expected provisions of what should be covered in the code, we then assign a maximum number. We assign points, put those into 7 different categories that add up to a total of 100 points for each country if their legislation is fully aligned with everything that has been asked for by the World Health Assembly. It is broken up into 7 areas: the scope of their legislation, what products are covered, how it is to be monitored and enforced, And then the various aspects of the code in terms of information, educational materials, promotion to the general public, promotion in healthcare, engagement with retail, with health workers and systems, and in labeling. And we give different points to each of those and the different provisions. Some are broad sweeping ones, so there are more points given to things like advertising and fewer points for the specific information that might need to be on the label, and add those up to these points that you see here. We then categorize countries. Those that get at least 75 points, we say are substantially aligned with the code. It doesn't mean that they are perfect, but in general, they're pretty much in line with what is asked for. Those that are 50 to 75 points are moderately aligned, and those that only get half of the points, they have some provisions of the code included, but they're clearly not protecting breastfeeding as they need to, and so their legislation does need to be strengthened. Next slide, please. So jumping into the results, what do we find here? In general, we find that the vast majority of countries, about 75% of countries, do have legislation that covers at least some of the provisions of the code. When it comes to public health, this is actually a pretty big success story, because oftentimes what is called for at the global level doesn't get translated into national legislation. So there is some success. On the other hand, for most countries, they only cover some of the provisions. They're not substantially aligned. Only 33 countries at this point are covered with at least 75% of the points that we give to the most important provisions in the code. The coverage is not quite so good in Americas and in the Western Pacific, where there are quite a number of countries that are not that do not have code legislation. And when we look at those that are substantially aligned, Europe and the Americas are doing the worst. In Europe, all of the countries covered by the EU have a directive that they all have to follow the same legislation, and that's why really most of the countries are covered, and yet they're covered with only some of the provisions. Next slide, please. When we look at how they're doing on specific provisions, I'm not going to be able to go into detail today on all of the provisions of the code, but we highlight certain ones that are particularly important. We're doing very well on some provisions, such as not idealizing the use of formula when we put pictures on the covers, on the labels or in materials, promotional devices at point of sale. So what we do in the retail environment is reasonably covered by most legislation. Somewhat surprisingly, there are still gaps in advertising and the use of the healthcare facilities for promotion. Some countries do cover this, but many do not. And there are other provisions that come in more recent resolutions of the World Health Assembly, for example, in terms of the sponsorship of meetings, where that is rarely covered in only a few countries' legislation at this point. So we really do need to fill these gaps in legislation that are allowing these loopholes, giving industry an opportunity to market its products, say that they're complying with national law, but still finding ways to push formula in ways that are inappropriate. Next slide, please. In this year's report, we really focused much more attention on what are we doing in terms of the monitoring and enforcement of the legislation. We looked at some of the key provisions that are covered in the legislation to see if they are actually doing a good job setting up monitoring. And what we find is that they typically call out who is responsible for monitoring. I say typically, still only half of the countries are even covering that. But they're doing a very poor job in saying how should the monitoring be done. And so what happens in many countries is that the legislation is on the books, but there's very little monitoring that happens. There are no resources provided for it. There are no procedures. And so they only catch violations that someone happens to report, and perhaps they take some enforcement actions on those. About half of the countries that have legislation do have spelled out what the sanctions for those ought to be, defined in the legislation, but again, have no procedures for imposing those sanctions. And so what often happens is that it bounces from one department of the government to another department to actually decide who is going to provide some kind of a sanction here. What should we do? Is this a serious sanction? Is this a minor sanction? And it ends up getting lost, and actually no enforcement is conducted there. So clearly some gaps here. So we've looked at these 5 different aspects of monitoring and enforcement. And next slide, please. Another thing that we added in this year's report was to see how effective are these code laws in supporting breastfeeding. when we look at how well they're monitored and enforced. So we look at the average rate of exclusive breastfeeding across all those countries that have most of these monitoring and enforcement procedures in place. And clearly they do a much better job. Similarly, as we look at the breastfeeding continuation out to almost 2 years of age, do a much better job when they actually do put in monitoring and enforcement provisions in their legislation. When we get down to those who do not put the monitoring and enforcement into their legislation, it actually turns out that the legislation is not effective in those countries. It may look good on our code status report that, yes, they have included a number of different provisions about the code, but then if they don't enforce it, it actually is just as bad as not having legal measures at all. So you can see these bottom two bars, the rates of breastfeeding are really the same, whether or not they have laws or don't have laws, simply because they're not doing the monitoring and enforcement. Next slide, please. Another thing that we added in this year's report was to do some case studies on what is going on in the legislative process in countries, and highlighted 3 countries in these: Azerbaijan, Sierra Leone, and Pakistan. And one of the key stories that came out across these legislative process stories was that industry is regularly playing a role in trying to delay or weaken or stop these measures from going into place. So before getting to the legislation, they were finding that industry was coming in trying to alter the text, argue on why there ought to be different ways to write particular provisions that would then allow them loopholes, such as saying no advertising except under the following circumstances, or if allowed by the Ministry of Health, that then allows them to do continued lobbying at a ministry level to get around the law and say, yes, we're in compliance with the law because we got permission to do it in this context. Other ways that they create these interpretations of the law that actually allows them to get around it. Sometimes they really fight against getting the law at all, so just make sure that it does not get enacted, so they're working directly against Parliament. They'll fund other groups to do that lobbying. They'll sometimes, once it is put into place in legislation, then start pressuring the president not to sign it so that it doesn't actually become a law. And then they try to work on reducing the fines and try to litigate against it on various procedural matters and say, well, this particular rule wasn't passed, wasn't followed in getting this legislation on board, therefore it's null and void legislation, regardless of all of the support that was there for it in the first place. So multiple ways to try to break this down. What the case studies also showed was that as civil society comes together with the United Nations, with the Ministry of Health, various champions, professional associations, those are there to defend the rights of children and defend breastfeeding. And sometimes they actually are effective in pushing back against industry. But it does turn out to be, as we look at these cases across countries, this fight one versus another, and we really need to strengthen our defense against this industry interference in the process. Next slide, please. So I want to just summarize with the overall theme of today's workshop in terms of, are we there yet? And I think we'd have to say, no, we're certainly not there. We're not at the end point we need to be. The promotion of these breast milk substitutes continues to happen across the world. You heard that from the mothers reporting at the beginning. We see examples of it through all of the research that we've done, country after country, demonstrates that this inappropriate marketing is continuing to happen, especially in digital markets, digital marketing through the digital environment. We have seen a little bit of progress, certainly not as fast as we'd like to in the last couple of years. There are 2 new countries that did not have legislation previously in the 2022 report. There are 3 countries that have strengthened their laws. So they had legislation before, but have made it a little bit stronger and moved their scores up. The report really demonstrated that monitoring and enforcement is weak. And so even if we have legislation, it's not doing a job at protecting mothers as it needs to unless it is enforced. And of course, there are industry efforts continuing to interfere with the progress on implementing the code in law. So we definitely have a long ways to go before we are there, but we are making progress. Next slide, please. Just want to thank you very much for your attention today. And I think, Fatmata, we now have another Mentimeter question for people to consider. In the last 2 years, has industry made it difficult for you to regulate the code? But how has industry made it difficult for you to regulate the code? So this is more of a text response. We won't expect long answers on this, but we think that many of you have had experiences with industry and what it is doing with regard to interfering in this process. So if you have some examples you'd like to share with us, some say that they're doing lobbying, they're using their own social media channels to get people to care about their interests. I'm happy to hear that in some cases they haven't seen that. Definitely false claims coming from industry, how they are paying health professionals, sometimes to do lobbying on their behalf, paying the health professionals to carry their messages going forward. They're having meetings with the Ministry of Health, influencing policymakers directly, manipulating the legislators in regard to their own personal situations as parents and grandparents, targeting vulnerable groups, seeking policies that permit donations and other specific issues, hijacking policymakers. So as you can see, across many of those who are attending on this webinar today, you're finding multiple examples of how industry is interfering in the process, trying to shape the entire implementation of the code so that they can do the marketing in ways that they have in the past and continue to innovate and work in digital spaces to keep finding more and more ways to push their products and work against breastfeeding. Just want to thank you very much for your attention as these scroll across and turn it back to Fatmata.
Thank you so much, Larry, for laying out the details of this report so beautifully. Colleagues, as you may have heard, this report really gives us an important roadmap of where our countries need to go from here to achieve optimal legislation, monitoring, and enforcement of the code. How each country gets there, of course, will look a bit different. And each country has important lessons to share on what has worked in their context and how to overcome the challenges and how partnerships can help countries minimize the impact of predatory marketing on their families. We welcome you to review the case studies in the report, which provide a number of examples, as Larry has already highlighted. We have also invited 2 countries here today. One was listed, Sierra Leone, to share a bit about their experiences. So today we will hear first from Honorable Air David Sheikh Kasegbama. He is the chairperson for the Nutrition and Food Security Alliance Committee of the 5th Parliament of the Republic of Sierra Leone. He also serves on the Committee on the Code and a member for nutrition. We will also hear from Dr. Rose Bella Joanna Benavides Moniz de Silva. Dr. Moniz de Silva is a distinguished medical doctor, currently serving as the National Director for Nutrition within the Ministry of Health of Timor-Leste. She has dedicated more than a decade of her work with the Ministry of Health, and she was recently appointed as the focal point for the Codex Alimentarius Commission in Timor-Leste. Colleagues, I would like to start with Honorable Aya Kasegbama. Honorable Aya Kasegbama, could you start us today by sharing a bit about your experiences with the code in Sierra Leone? The Honorable Aya Kasegbama, if you can just switch your video on so we can see you and hear from you.
Yeah, I'm right here.
Thank you.
Thank you very much, Fatmata. Thank you for such a platform to share our experience in industry interference, our country, and how we did it and how we went through everything that we went through. I want to first of all thank UNICEF, WHO, our Ministry of Health, the Nutrition Directorate, the director herself and her team It has been a great work done. It was not easy for us, but by the grace of God, we went through it successfully. But, you know, our case here has been challenging because everywhere you go, this thing has been there that most of the companies, whether they are factories in our country and those that are importing these products into our country, they have been having access to the House of Parliament, to the leadership, and trying to distract issues concerning this code. And what we did was, first of all, we tried to get access to the three arms of government: the executive, the judiciary, and the legislative. And getting them on board, automatically we had to make them they made their commitment that this is not about money. It is not about anything, but it is about our sisters, our mothers, and our children. And we have to prioritize it. And that was one of the great things we did that made us succeed. And without that, we shouldn't have had any access. But because we had the three arms of government on board, then we had other supporting organizations that came on board. It made us go through it. And one thing I will tell you, in the House of Parliament, it was challenging. But fortunately for us, two of us are part of the legislative committee. Being part of the legislative committee, whatever bills come into the House of Parliament, the legislative committee goes through it. After pre-leg, they send it back to the legislative committee to go through it and scrutiny it and see how we can manage it. And most times when bills come into the House of Parliament, most of these people, they go through the leadership and through the legislative committee so that they can make the bill at their own level, the way they want it. They will have to pour money, they have to do everything. But I will assure you that in the House of Parliament, they did whatever they wanted to do. But we stood there, and those of us that we are part of the legislative committee, we stood there. When it came from the cabinet, we involved lawyers from the judiciary part and the legislative part, and we came together and agreed that this is about our children. This is about our mothers and our sisters. This is about Sierra Leone. It is not about any institution specifically, or industry or factory or importers. So that was how we stood firm. And I will tell you, and you can attest to that, that we have one of the strongest laws in our region today. And we stood by it. But it was not easy. It was very, very challenging. Money was poured in. Whatever they did it. But we stood there because our focus was not the money, but for us to go through and make sure the code and everything comes to pass. That was what we did.
Thank you so much, Dr. Eya. Honorable, I keep calling you doctor, I don't know why, sorry about that. Honorable Eya Kasagbama, for highlighting how government and the parliament stood firm fast against industry interference to get the code enacted. I think that's a clear example of resolute, to support women and children and protecting infant feeding. Now let's hear from Dr. Moniz da Silva. I'm going to ask you a similar question that I've just asked Dr. Honorable Eya Kasagbama about telling us a bit on the experiences with the code in Timor-Leste. Over to you, Dr. Moniz da Silva.
Thank you very much for the opportunity given to us in Timor-Leste to share our experience on this progress and the process we face in Timor-Leste. And I will like to start by saying that for all countries seeking to introduce, adopt, or strengthen laws for regulating the marketing of breast milk substitutes, I think it is essential to align with the International Code of Marketing of Breast Milk Substitutes. And thinking of this, it's crucial to engage a broad range of stakeholders, and tailoring the legislation to local needs is crucial. So by looking at the local context that we face in our country. So thinking of that, involving all relevant sectors at every stage of decree law development process is vital for us, with clearly assigned functions and roles for each sectors and developing standard operating procedures for the implementation of the law itself. So utilizing public and influential figures and opportunities within government priorities can significantly accelerate the process for the development of the law. It is important to use all the available approaches at every level, including community, technical, and decision maker levels, developing robust legal framework with clear definitions and comprehensive coverage, ensuring effective regulatory oversight and enforcement, and promoting public awareness about breastfeeding benefits is also vital steps. So additionally, collaborating with international organization for technical support is very important, especially for the implementation of the mechanism for ongoing monitoring and evaluation will help ensure the law's effectiveness in the implementation itself. So in Timor-Leste, we face significant obstacles in private sector interference during the approval of the process breastfeeding breast milk substitute code. The private sector touches the decision makers to delay and alter the content of the decree law to their advantage. But in facing these challenges, requiring strong leadership and professionalism to prioritize the safety and well-being of the population. So all this process started in 2008 and was long with a lot of challenges, including frequent changes in government structure, shifting priorities, and recent pandemic. But the difficulty that we face, we try to continue proceed with the process with continued support from the agencies like UNICEF and other agencies which persist effort from various entities to be successfully introduced the decree of law in 2023. But still the challenges continue to come in our way. But still, we try to raise public awareness on the new regulation and ensuring the healthcare providers adhere to the code and successfully implement the law. And we also try to engage the civil society organizations in part of advocacy for the BMS code itself, and everyone here seems to support that because we think that it's very important to protect the process of breastfeeding itself, because it's very important for the babies and the well-being of the children to have exclusive breastfeeding and initial phase of their life, and also continuous breastfeeding until the age that are needed for the development of their for the maximum or optimal development of their growth and everything. So we think that this the code is very essential, especially for the country like Timor-Leste, that we think that breastfeeding is the best way, the better way for children to access for good nutrition. Thank you.
Thank you so much, Dr. Moniz da Silva. You really highlighted the key factors responsible for developing a strong code law in your country, which includes involving stakeholders, developing legal frameworks, and raising public awareness and collaboration around the code, which is really great. Thank you. I'll move over to Honorable Ea Kasegbama. I know Sierra Leone has one of the strongest laws in the sub-region of West Africa. I want to know how industry interference has been a challenge for you and how you've been able to overcome the industry interference and pass one of the strongest laws in the sub-region. Over to you, Dr. Honorable Kosegbama.
Yeah, thank you very much. You have been calling me doctor since.
Yes, I know.
Thank you for that. It has been challenging. You know, we know, as you know, as well as I know, and everyone on this panel knows, it's been a tussle, a challenging time, because most of these so-called industries, they have money, and they find a way how to obstruct, distract, and frustrate the efforts of such things. And we've gone through it, and we had such challenges wherein they had their way to see how we can minimize the charges also. That was why I said it was fortunate for us. Since 2019, we went to Cote d'Ivoire, and we heard about this and learned about it from other countries. When we came back, 3 of us, we had the passion to see how we can work on it. And we went through it in 2021 when the code was passed into an act. And automatically, they are still working. How? They tried to manipulate the legislative committee to see how we can reduce the fines. Because some of the charges and fines are very high up there, and we are trying to manipulate. You know, they have money. They use money to distract, especially in Africa. Africans, it is challenging. When someone sees money and ignores it, they will know that you have the credibility. And that has been our measure. They've gone in and out to see how they can bring it down. But I will assure you, they went to Parliament, had discussions with certain leaders of the House of Parliament, went to the Speaker of the House of Parliament, went to several other stakeholders within the county, but they didn't have their way because we had determined. We are focused. Even the health sector, there we are focused. That's why, first of all, I said I want to thank the UN organization, WHO, UNICEF, and other partners that have been working together with us to see how we can bring this thing to pass as it is today. But it has not been easy because they have people within the government. For instance, they have people within the 3 arms of government. They have people within the institutions. They have people everywhere, even within the CSOs. But what happened in our case was that we used CSOs that were determined. We had meetings, we had retreats, we had sensitizations with these institutions, and we had people that were specialists that presented the case to them and tell them that this is our target and we need to work on it because it will be beneficial to the country and it will be beneficial to our mothers and our children. So let's look at it and see. If you're a patriot of a country, you need to prioritize this particular thing. And that was how they failed. That was how they failed. They did everything possible, but they didn't survive until 2021 when we passed that bill into an act. It was a shocking one for everybody, and they didn't believe it. You can't believe it. When we went the final day of hearing in the House of Parliament, when Speaker said, page 1, page 2, page 3, he was just running everything because we had gone through it page to page and we had tried to put it the way we wanted it. Though they manipulated everything, but they didn't succeed. So we did our best. Every partners did their best. Every sectors did their best with the support of Ministry of Health and the director of the Nutrition Directorate. We went through it and they were not able to survive it. Because if we pay attention to them, they have people within powers. It's either the bill from passing into an act, or either they reduce certain fines so that they can be still operating. But thank God, we stood for, and the regulations we are working on now, it will be the best. I'll promise you that. Since we have been ahead in such case, we'll make it.
Great.
Thank you.
Thank you, Honorable Aya Kasegbama, for highlighting those steps that you took as a government to ensure that strong coal laws were passed in Sierra Leone despite the strong industry interference. I hope many of our countries and colleagues will be able to learn from that. I will move over to Timolesi, I have a question for you here. I just want to know what conditions made code legislation possible. I know your country just enacted legislation for the first time in 2023, but what made it possible so that other countries can learn from your experience?
So thank you again for the question. I'd like to answer that. What make it possible for us to introduce the code itself in our country recently? Because this current government they have priority to focus more on the infant and young child feeding program, which will focus on the breastfeeding itself. So the government encouraged to have 6-month exclusive breastfeeding and continuous feeding up to 2 years to respond for the problems that we are facing now in Timor-Leste, because we are facing big problem with malnutrition in our country. So this is the reason why the government has committed itself to implement the code by now. And the problem we are facing now is still with a lot of challenges in the implementation of the law itself, and also the monitoring process for the implementation, and also the engagement of other entities that support us in the implementation of the law.
Great.
But moreover, the reasons why we are implementing it soon, because the government priorities.
Great. Thank you so much. That really illustrates government's commitment to ensuring that a code is enacted in Timor-Leste. We want to thank you for all your contributions and support to this process. So just one last question to both of you. I will start with Sierra Leone and go to Timor-Leste. I know many countries are listening and really want advice from you, countries that have enacted code laws and really have strong code laws in place. What advice will you give to a country that is seeking to strengthen existing code laws? I will start with you, Honorable Aya Kasegbama, and then go to our dear Dr. from Timor-Leste. Honorable, over to you, please.
Thank you very much, Fatmata. I believe, first of all, I will advise that we be patriotic in every law or whatever we are working on concerning our nations and so on, because in a case for other countries, they are different. But for us, we had, as I have said before, and in my report or presentation in Geneva the last time, it went to the extent of even stopping the president to sign the document. But at the end, because of the support of other bodies, civil society organizations, and so on and so forth, they did it. So president had to sign it, and it came to a law. So my advice to each and every one that are working on their code at a time like this, don't forget to work with the 3 arms of government. They are very important. The executive, the legislation, the judiciary. Don't forget to work with the media. They will advertise, they will publicize what you are doing, and they will let the people know about certain informations that people do not understand. Don't forget to work with health organizations. Don't forget to work with health practitioners, because with them, you have a plain level field to work. There are so many steps in working. The CSOs are there. They will stand with you. The CSOs, they will work with you. They will go to the extent to see that you succeed. And I will tell you, for us, we had a civil society organization that were with us. Even when we stood as members of parliament, they were coming, even in the legislative meetings, the legislative committee meetings, the privileges, they were there to advise, to guide, and so on and so forth, and the judiciary. So I advise each and every country that are working on their own, let there be people within the three arms of government that are ready to make sure this thing comes to pass. Because even if the health ministry wants it, and people within the three arms of government are not ready to work it out because of most of this interference of these industries, it will not work. But when you have people within the three arms of government that are ready to make it come to pass, I'll tell you outrightly, no matter how the industries interfere into certain systems, they will not penetrate, they will not work. So I advise that you work with the three arms of government. Don't forget, work with the three arms of government. Get people within these three arms of government that are ready, that are really ready to make sure that thing comes to an act, that code comes to an act. And get people within the civil society, within the media, within the health factor, within the health sector that are ready. And stakeholders within communities being sensitized to know that these are the importance of this particular bill. These are the importance of this particular code. These are the importance of the mothers and the children. And then you will succeed. You will surely succeed. For us, it was not easy, but we made it. So these are some of the steps I think we took. And I'm sure that was why we succeeded in passing that bill into an act that has become a law in our country today for the code. Thank you.
Thank you so much, Honorable Kasegbama, for inspiring us and for really highlighting the role of the three arms of government, the legislature, and the other arms to ensure that a strong code is passed. So it really goes with the saying that we really need to bring a village together to pass a code. So it's not just one arm, all the three arms of government need to be involved. I'll now pass it on to our Ministry of Health representative from Timor-Leste to just give us some quick advice on what other countries could learn from their experience in terms of their journey to code legislation. Over to you.
All right. I will start by saying that it's not easy for every country to start the process and also to finally have this code in our country. But the advice that I could give is this long process facing a lot of obstacles. But what we have to look at is the context of our country itself, and also the priority, as I said before, the priority of the government. And to reach the goal, we need to work to all levels, like engaging all the community level and also the high level decision maker, and influencing them by advocacy and engaging all civil society organizations to also think of how important it is to implement the code for protecting the children in the country. And back to what I said, that by having the priority in the government, it's easy for us to get the approval of the law itself, and also engaging of the parliament to raise it in the in the legislation process. So yeah, I think every country that seeking for the support to strengthening the law in their country, they should adopt that in their process to finally success with the implementation of the law. I think that's all.
Great. Thank you so much, Dr. Dusilver, for those inspiring remarks. It's really important that government makes this a priority as in government plans to ensure that the code is enacted and implemented in countries. Thank you for highlighting that. So I hope you will be able to stay with us for a few more minutes as we take some questions from the government. I hope you will be able to stay with us and be available. I would like to start off with one question. Perhaps this will go directly to Larry. Larry, grateful if you can just unmute and be on the standby for this question. It's really about what steps WHO and UNICEF has taken to influence the WTO on re-renting trade agreements on the unethical trade and marketing. Countries, especially low and middle income countries, are helpless, although WTO says countries can exercise sovereign rights in exercising local legislation. But we all know how multinational industry interference is happening in reality and explicitly and implicitly. So this needs intervention at global level. Larry, can you just weigh in on this? Thank you.
Okay, thank you, Fatmata. So what we've really done is try to analyze the situation of the degree to which trade rules, trade agreements are barriers to enactment of the code. There have been a number of challenges to countries that if you pass code legislation, that's going to be against WTO rules. It's a barrier to trade. We've really tried to analyze the arguments that have put forward there and published a paper a few years ago that really documented that these claims are false claims. The trade agreements under the WTO already protect the sovereign right of countries to protect the health of their citizens, and the WTO rules don't trump those and they don't get in the way of those. What they do is they allow they protect against protectionism, that you do it in a way that will protect your own country, your own industries. So if you were to pass a code law that said, for those that are importing something into our country, they can't put this on the label, but for those that are making it domestically, they can, that would be a problem. But as long as you're doing it across the board, it's already covered. And because there's so much confusion about this, many companies and countries that are allied with them will raise objections and say, oh, you're going to be taken to WTO on this issue. And in fact, there's never been a case in which a country has actually been forced to pull back its code legislation or to not move forward on its code legislation. There are threats that are made, but it never has actually gone to a case where they had to back off, because the WTO does support that. In writing that paper, we did work with the WTO to make sure that we were giving a fair interpretation of those rules.
Great. Thank you so much, Larry, for throwing light on that. I still want to hold you, Larry, on a question that is related. How can governments help implement the code as a law while formula companies have, in some countries, collaborations with the Ministry of Health? Would you like to take that on?
These are certainly big challenges. We often think, oh, the Ministry of Health, they're always the pure ones, always looking out for the health of children. But definitely there are situations in which there are conflicts of interest. First of all, I think we need to recognize that there are multiple players in shaping health policy in countries. It's not just within the Ministry of Health. They can be pushed to do things because of parliamentary procedures. They can be pushed because of public opinion. So if we get a groundswell of people in the community, mothers reaching out and saying, look, this is unacceptable, we need to stop this, that can put pressure on the Ministry of Health. I would say a key strategy is to call out conflicts of interest where they do happen. And so where people know that there are things happening of ministry officials being funded by industry or having close financial relationships with them in other ways, to make that public, put it into the public sphere so that they can be held accountable for that. So we need to push these through. We need to find who our partners are to advance code legislation. We'd like that to be in the Ministry of Health, but we recognize sometimes it's not. Sometimes it has to be civil society and parliament pressuring. So oftentimes there are opponents and friends in multiple different sectors. We have to find who those friends are and find where the barriers are and push back against them.
Great, thank you so much. So I will shift to our two panelists from Sierra Leone and Timor-Leste to help us respond to this. Where do we start? This is a question from countries. If we want our legislatures to hear us or even consider legislation supporting the code, where do we start? Sierra Leone, Timor-Leste, is there just a quick response that you can provide for this? I mean, where did you start in all of this?
Yeah, thank you very much, Fomata. We started, first of all, as I said it before, from Abidjan. We had the passion. First of all, let's have the passion and what it entails for us to pass the thing and get the code. That should be our priority. And coming back to these three arms of government, there should be people, tireless people that are ready to stand to make sure that this thing comes to pass. Without you having them, it will not be easy for you to go for government to pass it. It won't. And one major body that I didn't talk about is the religious body. One of the areas they use is religion. That why should you do this? Why should a mother breastfeed for this? Why this and that and that? And we used all these bodies that made us to go through what we went through. So you start, first of all, having passion for the code, and then working directly with the three arms of government. If they are there for you, you will succeed. Absolutely.
Great.
Thank you.
Thank you for reinforcing the point on the need to work with the three arms of government. That's very clear. Let me hand over to our colleague from Timor-Leste. What would you say about this?
From Timor-Leste, I would like to say that we start all the process by looking at our own situation, the local context that we are facing now. So there is a need for the Ministry of Health to develop the program to protect the children. Because of that, with the help of other agencies and also civil society in the raising the awareness of the community of the importance of breastfeeding, and also the work on the advocacy in every level. We reach up to the government and also the parliament to think that it is important to create the degree of law to protect our society, to protect our children, and also to practice the best way and feeding the children with breastfeeding. And with that, we think that after seeing our own situation in the country, we make it possible for the government to oversight or look at the importance of having the degree of law and pushing it to happen. So I think it's all a big process, but with the commitment from the government, from the Ministry of Health itself, and also the help of the civil society and the awareness of the community, we make it happen all together. And with the decision, the right decision that the decision maker made, I think it will ensure all the process, and you will all get the code established in your own country.
Great. So it starts at the right decision-making level, just like Honorable Ea Kasagwama highlighted, working with the 3 arms of government. These are all important steps. Larry, I'm just going to go back to you. This is a question that relates to if the IMF can pressure countries to implement certain policies in order to access funds, can something along the lines not be done for healthcare in the case of code to further pressure the industry to make significant changes? Do you want to take this, Larry?
It's a very challenging question, Fatma. I don't know that I want to take such a challenging issue as that. We certainly work across the UN agencies and banks to try to get better adherence to international health policies. And so we do have these kinds of conversations with them. But as you might guess, the IMF is under lots of pressures from multiple sectors, multiple health issues, multiple other development issues. And their primary focus is on finance. And so there are many things that we would actually like to do in health to build incentives in financing along these lines. So I certainly would say I'd like them to hold that same kind of thing that's been proposed here, to make it a condition of funding to move this forward. I think that it's going to be a very challenging area. I think we probably have better chances under like human rights approaches as we hold countries accountable for human rights, that we build the code into that. I think we can get the banks to think about this issue more, but making it a stipulation for their funding, there would probably be many other issues that would be up against as well. It's not that they're opposed to it, but I think that they would find it a challenging space to try to step into all the other issues that they're also facing.
Great. Thank you very much, Larry. This is really insightful. And I think we have a lot more questions that we could answer in the chat or live, but in the interest of time, I would like to ask that I move to a general question, a general pooling Mentimeter question that will cover the steps that your country will take to improve code legislation in terms of monitoring and enforcement. Janet, you want to put that up, please? Thank you so much for your feedback. This has really been engaging and enlightening. Keep going. Engage government, work with the media. Beautiful. Make presentation to any candidate who comes to my door. And the European elections this month. Beautiful. I have information about the code in the breastfeeding class that I offer. Engagement with government and civil society, engagement with government. This is a recurring theme. Beautiful. Lobby with government representatives. I think we have learned a lot from the Timor-Leste experience and the experience from Sierra Leone, that it's important to engage with government as a first point of contact. Let the government know, and every mom educated. Update my blogs. I will pressure WHO, Larry, that's a lot of work for you there, to give money to non-profit entities other than IPFON. Okay, UNICEF UK BFHI implementation, improve awareness. These are all excellent responses. It really shows that we are all committed and want to do something about the code in our different contexts. And we really look forward to working with you all and hearing from you. And thank you for all your thoughtful responses. I will now turn it over to Francesco Branca, who is head of the Department of Nutrition and Food Safety for the World Health Organization, to share some final thoughts with us. Francesco, over to you, please.
Thank you, Fatma, for your excellent conduction of this meeting. And I really would like to thank all the people who have been participating. We had over 500 participants in the meeting, with the very lively suggestions also in the chat. I'd like to close where Victor, my colleague Victor Aguayo, started, and that's actually to celebrate the progress. Because with 10% more children who are exclusively breastfed, we have made a lot of progress on public health. So I'd like to, however, reflect on the answer to the first question of this meeting, which is, are we there yet? And probably the answer that was given is not yet. So we've done progress, but we need to do better. And probably an implicit question is, and what next? And I would say that in terms of our level of ambition, we definitely can have a greater ambition for children of the world, to give them the best start in their lives. And at the moment we're discussing, next week there will be the World Health Assembly here in Geneva, and we're discussing what next in the global nutrition targets. If we have achieved almost, we'll achieve the 50% children exclusively breastfed under 6 months, which was the global nutrition targets, we can continue with the trajectory of a level of ambition and aspire to have many more children, maybe even up to 70% children who are exclusively breastfed in the next few years. And I think we have really a compelling argument there. The epidemic of obesity, which is really now affecting 1 billion people in the world and 160 million children, needs important public health measures. And the promotion, protection, and support of breastfeeding is one of them. So I think we have yet another compelling argument that breastfeeding is really the public health measures that we need. What next? I think the report mentioned a number of areas for improvement. We need to focus on aspects of the legislation which will stop marketing in healthcare facilities, the professional societies, the marketing to health workers. So we need to implement the baby-friendly hospital initiative, in particular the steps that are related to restricting, banning the marketing of infant formula in health facilities. So that's an important area where we have to work. Another important area is the monitoring and the enforcement. In these years, we've become better in collecting the information and analyzing the information on the implementation of the code. But we need to have perhaps more people's awareness and engagement and involvement. People have to flag the violations, and we all need to be able to have capacity to identify the violations to the code in real time. The big challenge is, of course, what is coming next, and that's the digital environment, which is unfortunately still pervasively promoting the infant formula. There's a lot of new techniques, and we risk to lose ground on what we have achieved with the new digital marketing techniques. So if this is the agenda, and if this is the ambition, how are we going to do it? And I was impressed. I must say, I was impressed by the speakers and the panelists. I think the first thing we need really is leadership. And leadership of policymakers, members of parliament. Honorable Kasek Bama, my kudos. This is exactly the example you need. And I took note of two things you said. We said we are determined and we are focused. So we need leaders who are determined and focused. And the experience of Timor-Leste with all the challenges that the countries have is absolutely critical. So breastfeeding is there in all contexts, including difficult contexts such as emergency context. The second thing, of course, we need is collaboration. Collaboration, and I'm really proud of the collaboration that WHO and UNICEF have been having in these years on breastfeeding. I'm very proud about the Global Breastfeeding Collective. These are global collaboration, but what we've heard is the importance of country-level collaboration, civil society, the collaboration and the input of civil society organizations in their legislative process, the media, people. And perhaps the third thing is we need to respond to the new challenges, but also with innovation. And how we're going to deal with the digital marketing. We need the capacity, we need probably to harness some of the new technologies such as artificial intelligence systems to track the internet traffic on marketing breast milk substitute. But I am optimistic. I'm optimistic because I think the energy which is behind all our movements to promote, protect, and support breastfeeding is very lively, and we are celebrating successes. So that will keep us going. So thank you very much, and back to you, Fatma.
Thank you so much, Francesco, for those beautiful closing remarks. Before we end today, I would just like to take a moment to thank our speakers from Sierra Leone and Timor-Leste for generously sharing their experiences with us. And please join me in thanking our authors for the report at WHO, UNICEF, and IPFAN. I will not name them individually, but you can see them on the screen. Thank you so very much. I would also like to thank the members of the Global Breastfeeding Collective Task Force for their efforts to bring this webinar to you today. It's no small effort, I can tell you for sure. It's a lot that has been involved in the background. Thank you very much. And finally, I welcome you all to commit to taking action. What can you do? It's not just about listening to the presentations today and the key findings of the report, but we want you to go home and take specific actions. And one of those actions could be you could commit to reading the report. I'm sure our colleagues will put a link to the report on the chat. Read it, digest it, and know what it contains. And then you can also learn your country's score. There are a number of scores for multiple countries in the report. Know where your country stands and what action you can take to support your country improve this score in the next code report. And most importantly, talk to your government about what they can do to increase their scores in the country. You have heard from Timor-Leste and Sierra Leone. They've all collectively emphasized the need for government involvement. So it's important that you take action and talk to your government in terms of what needs to be done, because together we can protect families from the predatory marketing techniques used by formula companies. I want to thank you all for joining our webinar today. and I would like to close this webinar at this moment. Thank you all and look forward to sending the relevant recordings and emails. Thank you.